the timeliness of therapy and how payers ensure that patients get access early to treatment for SMA is one of the thorniest questions that everyone, all stakeholders are wrestling with. It's not only payers too. I'll broaden it for a second, then zero in on the payer perspective and how managed care deals with it. But timeliness is incredibly important here because we're trying to prevent deterioration. You're trying to, sort of allow these, sort of patients, these infants really, to, sort of continue to march on towards motor milestones they wouldn't otherwise achieve without treatment. That's the point of all of this, and I don't think any of us want to lose sight of that. So earlier treatment, from the data that's available and conferring with experts, I think we all agree is really important. Two complications have emerged that I think everyone is still grappling with. One is that the differential diagnosis can be very broad. So until there's really a, sort of either a sort of mandated screening that takes place, and so we know when people have the deletions that lead to the disease to start off with, we're left with when these symptoms start to show up and patients are missing motor milestones, and it can mimic lots of other things, then what happens in that diagnostic process? And I would say, just before I zero in on the payer issues, that time to diagnosis is still probably the most important thing, just looking at it globally, that dictates the timing of treatment. Because is the diagnosis suspected, or does the person say this is just a baby who hasn't hit their, a little floppy and hasn't hit their milestones, and is still in the range of even normal or has a different, sort of clinical presentation? So that aside for a second, once the request has been made now and the diagnosis is in sight and the payer is involved, payers are trying to do a couple things to ensure, and this is, these are activities that are relevant to SMA, but also, sort of more broadly for prior authorizations. One is that there's a lot of effort and resources going into the electronic extraction of the necessary data to fulfill the PA criteria behind the scenes. So the doctor submits the request or says, is notified that a PA is required, and all of the data that's needed to confirm that this patient is appropriate for treatment according to the medical policy that the payer has in place is fulfilled without the treating physician and his or her staff having to do anything else. That's the future. That is where a lot of resources are going. And so I think payers are increasingly making progress on that path to be able to get to that state. That said, that's not the norm right now, especially when there are specific laboratory values that are required and so on. So rare disorders get an expedited review in most cases from payers, because obviously timeliness is of the essence here. However, the delays are typically when there's quote unquote additional information required, and most often clinical documentation is the additional information they're looking for. So there is a lag when that additional information is part of the policy and the person doing the review says, I can't render a decision until I get that. And then we can see delays of up to 10 days. So, which is an eon when you're talking about sort of families dealing with this.